What are exosomes?
Exosomes are the face of biogenerative medicine. Exosomes are cellular messengers, and they help to stimulate collagen and elastin in the skin, and that gives volume and helps to rejuvenate the skin.
Which areas can exosomes be used?
So we use exosomes to stimulate collagen and elastin. Usually we use them in areas of volume loss on the face. This is typically in the lateral cheeks, sometimes in the mid-face. They can help boost up and support the tear trough and the mid-face. And sometimes near the jawline as well. These are the common places that we use exosomes. We've also started using them below the eye, so the infraorbital area. And that helps to build your own collagen and elastin, so it keeps the skin from getting baggy, and it can lessen perhaps the need for filler as a first step anyways. And most recently I started using exosomes in the temples as well to stimulate collagen in the temples. So if people have a real concavity, and that's a sign of aging, we help to build that volume back up safely. There's no risk of vascular occlusion because it's not filler. And so it's an excellent choice for safely filling in the temple area.
Are exosomes the same thing as stem cells?
No, not at all. Exosomes are not stem cells. Exosomes are little vesicles. They're little nanoparticles that have different factors for skin growth. So they can have nucleic acids. They have oligopeptides that are biomimetic, which means they have a function in the body. They also have different growth factors that help to stimulate the fibroblasts, which are the cells in the skin responsible for making the collagen. Stem cells, on the other hand, are undifferentiated human cells that interact with different tissues in the body, and they can develop and transform into those particular organs' cells. So they're much different than exosomes, which are like akin to cells from one organ texting a message to another cell in the body.
How do exosomes help my skin?
Great question. Exosomes, what they're doing is sending a message to the fibroblasts, like we were saying, that basically it stimulates two types of collagen, type 1 and type 3. You get a firmer skin because you get a better structure underlying inside the dermis. And they also help to produce elastin, which is what causes the snappiness of your skin. It's what keeps everything tight and young and youthful. That's one of the major benefits of using exosome therapy. Why I am starting to prefer exosomes as a go-to for improving skin quality is that simply they do not cause damage to the skin. So when we look at other options that stimulate collagen, there are some products that are based in acids, and the acids create a chemical reaction under the skin that creates type 1 collagen, but not type 3 and not elastin. Whereas with thermal energy therapies, what happens is there is a heating of the tissue underneath the skin, and that creates a tightening effect. It creates type 1 and type 3 as well as elastin, which is great, but there still is the effect of a burn, and it's inflammatory. With exosomes, we're only injecting the messenger. So that messenger is not inflammatory. In fact, exosomes are anti-inflammatory. They reduce different cytokines. And largely this is excellent because what happens is there is no physical damage to the underlying tissue. They just get fooled into creating an immune response. And that immune response is what creates the collagen and elastin.
Can I become overfilled?
The answer to that is no. The beauty of using the body's own natural processes to create the collagen itself is helpful because that process itself is also regulated. Once the skin in the dermis has filled as much collagen as it normally would have had in your youth, what ends up happening is it gets a feedback loop that turns off the collagen production. So you'll only get to where you started, basically. When you were younger and you had more collagen, that's what you would return to. And that's the beauty of this. If you imagine that you cut yourself really badly, you don't have a giant lump of extra tissue after the collagen and the skin repair has happened. It stops at what you had before. It's akin to that. It's very much once that natural process turns itself off because it's been maximized, the process stops. You never have that pillow face or the overfilled look that you can get with a foreign agent like a dermal filler.
Are human exosomes better?
Great question. The answer to that is no. There are pluses and minuses for both, but the main concern that I have with human exosomes is the potential for the transmission of human genetic disease. The other possibility is that there could be genetic debris that could be inflammatory in our body. We want to have the purest form of product possible. The non-human exosomes that I use can't possibly create human disease because they're based in salmon and plant stem cells. So we'll never have your face turn into a carrot, for instance, and you can't grow gills the last time we checked. It's a much safer process using non-human exosomes.
Can human stem cells or human exosomes cause cancer?
The issue is that there is data in the literature that demonstrates that stem cells can interact with human tumor cells. So if there's a pre-existing cancer, these stem cells can interact, and so can human exosomes in theory. There needs to be more research to make sure that we're clear on whether that's an actual risk, but currently the understanding is that they are safe to use in humans. Exosomes that are non-human don't carry that risk of interaction with human tumor cells because they are too far apart evolutionarily. And ultimately, they don't have the same ability to interact with tumor cells to make a favorable tumor growth environment, is what it's called in the literature. The human stem cells and human exosomes could potentially help a tumor cell have the right conditions to grow, and non-human exosomes and non-human stem cells, like plant stem cells, don't have the same capabilities. In my view, they are safer to use off the bat.
Are synthetic exosomes better or worse than human stem cells?
Usually, we always feel like synthetic things aren't the best and so on, but this is one case where I feel that synthetic peptides and synthetic exosome materials are ultimately better controlled and standardized. What I mean by that is, in the case of the product that we're using, there is an empty vesicle that gets filled with specific growth factors, nucleic acids, oligopeptides, and peptides that are biomimetic, meaning they have a function in the body. And there's nothing else. There's no possible genetic debris. There is a screening process to make sure there's no prions or any of the other contaminants that could be possibly harvested with human products and whole stem cells. The issue there is that the synthetic allows you to have a standardized dose of 1 billion working units of exosomes per dose that's given, and we know that as a practitioner, so that's how I feel safe knowing exactly how much I'm giving. And also it makes for a more stable product, which can't suddenly become affected by being left out in the wrong temperature and then being less effective. There's also a standardized amount. So where you have stem cells being harvested, how do you know how many stem cells there are in any particular umbilical cord? It can be variable. So this is why I like knowing with clarity that I'm giving, exactly 1 billion units, and I know that it's stable and can't be changed during the shipping or storage process.